Hey everybody, welcome back to the Outcomes Rocket. Recording here from Becker's Healthcare. I am with Paul McRae. He is at Nordic Global Consulting. Thank
Correct.
you, Nordic Global Consulting.
Correct.
Such a pleasure to have you here, Paul.
Thank you for having us. Nordic is a well-known firm in the EMR space. It's something that we have multiple years of class awards for being an excellent partner in delivering EMR-related services. Generically speaking, Nordic was founded by guys that used to work for Epic, and they caught that wave. Over the course of time, we expanded our portfolio and started focusing on Cerner and Meditech, et cetera. What makes us unique is what I would argue is that we really play in four areas. One around performance improvement, which would be best defined as your traditional management consulting, revenue cycle optimization, performance improvement, process reengineering. In addition to that, to the right of that, we would say we have a digital health practice which includes data analytics, interoperability, cybersecurity, and then our cloud services team. And through that organization, what we do is try to help clients to organize what they're trying to do and then create a roadmap or a strategy. And one of the things we constantly say to clients is we want to meet you where you are. And then once we get to the other side of that and you made a decision on how to involve your business, we have an implementation services team because of our deep experience in putting hands on the EMR, as well as a company that we bought that was focused on Infor, and now we're building a Workday practice around that as well. But what makes the migration of the business or the evolution of healthcare better stated is that clients are now, one, having to do more with less. Operating in a single-digit margin makes it difficult for you to do those innovative things you would want to do. And so ultimately, a conversation starts around how do we reduce cost, which gets into the optimization, which gets into performance improvement, and then we start to build the roadmap on where you want to go and how you want to involve your business. And the last pillar, if you would, is our managed services team. And just simply, if you think about the innovative services that you want to put in, SaaS solutions that you see on the floor today, the challenge is those types of resources don't exist within the client environment. So we have the opportunity to apply a managed services model. Could be leveraged as train the trainer. So now we're training up the resources on site at the acute system, or we're leaving bodies on site to accomplish a specific project over a period of time. So Nordic, I think, is well positioned to be involved with helping our clients through this wave and this change and innovation.
Yeah, thank you for that, Paul. It sounds like you guys have a very well structured offering that helps people with strategy to implementation to just bridging those gaps.
Absolutely.
Within their organizations.
Absolutely.
At the conference, there's been a lot of conversations around different topics like AI, revenue cycle management, what is the role of a CMIO? What particular insights have you picked up here that you feel that our audience could benefit from?
Well, that's an interesting question. I'm probably unique in that regard, is that I haven't been to Becker's in a few years. And several years ago when I was with ServiceNow or VMware, one of those stops along the way, I noticed the heavy emphasis on rev cycle. What I've observed through this particular trip is this evolution with understanding how rev cycle supports the innovation in other parts of the business. You're seeing more SaaS or cloud-based options for clients to consider. It's rare that I have a conversation with a CIO and he says, Paul, I can't wait to build that brand new data center. No one talks like that anymore. And so as these clients are looking for opportunities to reduce costs, you see vendors have embraced that by being a little agile in how their services are delivered. What I also found interesting is I sat through some sessions and clients are asking deep questions around, it used to be the EMR data was the most important. Now I need to focus on operational excellence, data-driven decision support. And so the conversation where it used to be solely about the informaticists and the data inside of the EMR now has evolved to include the CFO office around Oracle or ERP or Infor or Workday data, which touch the operation of the system. So pretty pleasantly surprised on what we found here this trip.
That's great, Paul. And folks, that's the beauty of making it to conferences like these. You have fascinating conversations that help you make tweaks and pivots.
That's right.
To best serve the market.
My family, I come from a family of clinicians. My father was a gastroenterologist. My father-in-law was a surgeon. And so at the age that I am, I've seen the evolution of healthcare from HMOs to PPOs, et cetera. And it's really always been a financial model in the background. Obviously, we're here with RevCycle, but now we're at a point where the population is aging. Your payer mix is going to drastically change as this population moves on to public payer programs, which at its simplest level means less dollars to spend on innovation. So now we have to be very laser focused in how we do it. It's not a lift and shift like implementing the EMR, it's a roadmap. How you can evolve your patient delivery model, how you can begin to support the other entities that you're engaging with in the broader ecosystem. What tools and things should I be considering or not considering based on the types of services my hospital provides? So it's a little bit of consulting, a little bit of strategy, a little bit of delivery, and then we're going to be there to help you run your business afterwards.
That's fantastic. Paul, well, thank you so much. This has been a fantastic conversation.
Hey, thanks for stopping by.
Absolutely. For our audience that wants to get in touch with you, what would be the best way to get in touch with you and the firm?
I would tell you the best way to find us is Nordic Global Consulting. I'm specifically a part of the digital health practice. Can be found on LinkedIn, last name McRae, and I'll get back to you as soon as I can or get you plugged into the team that can help.
Outstanding, Paul. And folks, the ways to get in touch with Nordic are in the show notes, so make sure you check those out and also check out the way to get in touch with Paul. Thank you all for tuning in with us, and Paul, thank you for being with us.
Thank you for having us all.